So I'm Philip. I'm a professor of oncology. I work at Wayne State University and Henry Ford Hospital in Detroit. I'm a medical oncologist. I specialize in GI malignancies. My major area of interest is in pancreatic cancer, but also in neuroendocrine tumors, although I treat all GI cancers. I'm here for the GI ASCO or ASCO GI because of the reason I gave you. I'm really interested in seeing what is new in GI malignancies, but also at the same time trying to network and interact with other people who are here doing the same thing, including pharmaceutical companies that we collaborate with in terms of their drug products. In pancreatic cancer, the real news is that there is a lot of interest in targeting KRAS, which is mutated in the majority of the pancreatic tumors. So 90% of tumors have KRAS mutations, and now there are many approaches to try to target KRAS and help the patients. This is something revolutionary. It wasn't there before. Like, let's say, 10 years ago, it would have been, or even 5 years ago, it would have been like, oh, we can't target KRAS, but now there are drugs that we can target KRAS. So this is really what's going to come in the next 6 months, 1 year. You're going to hear about KRAS targeting, and it's going to really be a revolution in the treatment of pancreatic cancer. So stay tuned. There are other treatments that we're trying also to develop in pancreatic cancer. For example, targeting MEK pathway. There's an interesting compound that is being developed now in combination with chemotherapy. Immunotherapy is also being tested and see if we can find a way of combining it with drugs that can make immunotherapy work. There's also evidence that the electric fields, tumor treating fields, applying it around the abdomen, that can also prolong life of patients who have locally advanced pancreatic cancer. So this is just, I'm giving the examples and a feel of where the field is going. There's a lot to be done in this disease, and also in the field of GI malignancies. There is also talk about different combinations of immunotherapy in the upper GI cancers. So there's a lot which is going on in this disease, pancreatic cancer, but also in the other GI malignancies, especially upper GI malignancies like gastroesophageal cancers. So the future looks really very interesting. It certainly is much better than when I was 30 years ago. I started in Detroit when I went there as a junior faculty, but things are much different now throughout the world when it comes to gastrointestinal malignancies. So one of the exciting things I am always looking forward to every 2 weeks is the 1 hour tumor board I do with Armenia, with Yerevan. So I do it from my office. Usually it's around anywhere between 7 a.m. to 8 a.m. when we start. This is Eastern time, Eastern USA time, and we spend an hour or more than an hour, and we go over 4 or 5 cases. And that's something which I really enjoy because we have people joining from Armenia, young doctors who are oncologists and people who are working around cancer. And I learn a lot from them because there's a lot of things that sometimes are a bit different, whether it comes to epidemiology, whether it comes to risk factors and management, and also the drugs that are available and diagnostics. So it's really very rich source of interaction. And my hope is that we can do some manuscripts and studies together, research, and working with them. So that's something which I really am proud of that I'm able to do. And I'm really thankful that they asked me to do it. And I very much enjoy it.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.